Hi, it's December 13, 2020. My name is Marie Wells. The Yukon twin PD Connie is here to read about direct access to physical therapy services, an educational module by authors Elizabeth Dumholt, Anne Clausen, Pauline Flesch, Tamara Taylor. This module is courtesy of Nova Southeastern University Health Division Health Profession Library from Florida. Thank you, NSU. So this segment I will read about physical therapy for older adults. HO2 06-95-15-08 Program 32. Initial HOD 06-87-09-16. So it is the position of the American Physical Therapy Association, APTA, that the healthcare delivery system of this country should incorporate the wide spectrum of services required by the rapidly expanding older adult segments of our population. Appropriate interventions enable the older adults to maintain or regain a degree of physical and mental well-being. Policymakers in the field of health services for the older adults should have a positive attitude toward constructive change and be aware of certain findings and principles. The quality of life for older adults may be enhanced by healthcare professionals who have specific knowledge about the effects of aging process, the difference between normal and abnormal aging, appropriate therapeutic interventions, and available social and political support system. Prompt and coordinated services provided by the health professionals can help to avoid hospitalization, decrease the length of institutional stay, reduce the amount of care required after discharge, prevent complications, and improve the individual's level of functions. Successful intervention contributes to the diminishing the physical, emotional, and financial burdens of aging experienced by many older adults. The American Physical Therapy Association urged legislative and regulatory bodies to promote appropriate utilization of physical therapy services by adopting the following principles. So listed here are 12. I'm going to read number 1. Physical therapy services to enhance or maintain mobility and function provided in home health settings, outpatient clinics, respite care centers, and adult daycare centers frequently offer alternatives to high-cost institutional care. So number 2, outreach physical therapy programs should be established to improve the availability of physical therapy services for older adults in rural, low-income, underserved, and unserved areas. Number 3, health and wellness promotion and preventive programs should be supported for the older adult to prevent or delay the development of many chronic problems, which often result in the utilization of more costly services. Such programs should include a physical therapy component. Functional assessment by physical therapists is essential in determining the needs of older adults population and monitoring the outcomes of care. Safer living environments should be considered by individuals of all ages to prevent accidents and potential institutional admissions. Home and community environments of older adults should be evaluated by physical therapists who can recommend appropriate environmental adaptations that eliminate or reduce architectural and design barriers. The provision of the physical therapy services should not be limited by arbitrary reimbursement restrictions. Medical diagnosis alone provide a limited understanding of the physical therapy needs of the patient client. The response of the older adult to physical therapy intervention may be slow and is often complicated by multi-system disease. Perceived plateaus in the recovery process should not necessarily result in the discontinuance of the physical therapy services. The short-term savings in healthcare costs derived from premature termination of the treatment may eventually result in the need for more costly services such as institutional care. Number 7. The physical therapy should be primary evaluator of the physical therapy needs of the individual. Consultation by a physical therapist should be linked to all aspects of preventive, rehabilitative, and restorative care programs. Such consultations should include the planning of education and training of staff, ongoing assessment and revision of patient-client plans of care, and the disposition of patient clients in each type of programs. Number 8. The provision should be made for physical therapists to provide educational sessions for patient clients and caregivers in the disease process and preventive measures necessary to continue to care for older adults at home. Number 9. Claims review for physical therapy services provided by or under the direct supervision of physical therapists should be conducted by physical therapists. Research finding should be continued or made available in the following areas. There are 4. Letter A. Outcome effectiveness studies of physical therapy intervention. Letter B. Innovative models of healthcare services for older adults. Letter C. Health promotion for older adults. Letter D. Basic and applied studies of the mechanism of the disease, impairment, functional limitations, and disability associated with aging. Funding in number 11. Funding the development of educational and service programs should be available to address the personal and the societal costs of impairment, functional limitations, and disability associated with aging. Such program would assist society in avoiding the high costs associated with institutional care of older adults. Number 12. Fundings should be provided for accessible transportation services that allow the older adults to receive services in the most appropriate setting and live at home. So that's the 12 principles that is being proposed by the American Physical Therapists Association to the legislative and regulatory bodies to promote appropriate utilization of physical therapy services as of from the four authors, to wit, Elizabeth Dunholt, Anne Clausen, Pauline Flesch, Tamara Taylor. Okay, once again, this is Marie Wells, the Jucon's twin PT Connie. Thank you for listening.